from here, as I said, I've already done my presentation here. You know who I am. I'm an asthma nurse. So I'll carry on with in terms of the asthma reviews. Just bear with me 1 second. Just want to see if I can have a quick view of let me just see if I can move the slide to the other side, just because the slide's not looking. I'm on 2 different screens, so sorry if I'm not looking exactly at you sometimes, okay? That's the reason. So in terms of the asthma reviews, it's so important to come. Sometimes people feel like, oh, I think my asthma is well controlled. Why do I have to go? Why do I need to bother? I'm doing just fine. But the truth is that by coming to these asthma reviews, you actually have a great opportunity for us to look at it together, sit down with a clinician that understands asthma and management of asthma. We can look at your medications. We can also check your inhaler technique. We can talk about any changes and triggers. We can make sure that your asthma action plan is up to date. The asthma action plan is actually personalized to you. It's not something that we apply and give generally to everyone the same. So it's by doing these reviews, attending your annual reviews, or whenever you're getting an invite, that we have this opportunity to make sure you have the most up-to-date information, okay? So if you think about it more like a health checkup, these days you might have received already an NHS health check invite, or you just haven't been to the doctor in a while and suddenly you think, oh, it'll be good to do a checkup. So if you look at it that way, it might be a bit more interesting to actually attend, okay, for these checkups. Now, if we are looking into inhaler technique, a lot of you may have had asthma from childhood or for many years, more than 10 years, or maybe you were just recently diagnosed with asthma and you're here to get more information about it. And inhaler technique is very important. What I usually say when I'm seeing patients is that the inhaler technique is just as important as the medication itself. If you're not able to do the inhaler technique correctly, then you're less likely to actually experience the benefits of that medication. Because then if the medication is not going in the right place or not staying there long enough, you are not going to reap the benefits of it. And therefore, you would see that your symptoms might continue. You might not get the reliefs that you expect. Okay. So getting it right is very important. Now, as you see on the slide here, I have a little picture with lots of different inhalers because nowadays we have many options. Obviously, it's very difficult for us to show you every single inhaler, but you may be able to identify from here. I'm going to try and see if I can show you. I've done a quick video just to show you how you can yourself, just from Google, reach the Asthma and Lung UK website and search and see for yourself which inhaler you're on and actually watch a video. You can select and watch a video from that website and see it at home as many times as you need to. Okay, so I'm going to hit play. I hope you all can hear. Let me know if you can't. Okay. So here you're going to go to Google. You're going to be typing how to use your inhaler, Asthma UK. Press enter. You're going to click on the first link that comes up. You're going to come straight onto this page. You see if you scroll down, there's many options. You can just scroll down and look for the picture of the inhaler that looks similar to yours. So if you are using a dry powder inhaler, for example, as the Foster Nexthaler, this could be the link you want to click on. If you are using Ellipta inhaler, this would be the link to click on. You can also see other common ones like the turbo inhaler, could be your Symbicort, or the Easy Breathe, could be here as well. So basically you're just going to go down here and you're going to look for the image that looks like your own inhaler. Once you find your inhaler, let's say if you are selecting the salbutamol, for example, or the brown inhaler, the Clinell, you could click on this link, and once you click, it will take you to another page where you can click on the video by just pressing the play button on the middle of the screen, and then you'll be able to access the video and see it. Okay, if you think the screen is too small, you can also
I'm a consultant respiratory physician.
increase the size of the screen.
How to use what's called a pressurized metered-dose inhaler, or PMDI.
Or go back.
It is also sometimes known as a puffer.
And you can choose perhaps another inhaler. Let's say we're choosing the Symbicort turbo inhaler. You can click there and you will see also another video, and again you just click on the play button in the center, you get a lovely video. Okay, so just wanted to give you a quick show of how to access this website, the Asthma and Lung UK, because you will find many helpful resources. You can see right on top here they have a helpline number you can dial and speak to somebody that will have they'll be able to support you, okay, as well. So here you're going to go to Google.
Oh, sorry, didn't mean to play that again. Let's see if I can go to the next slide. Bear with me. So for the sake of making this short, because we have limited time on the presentation, I thought I'd show you at least the inhaler technique for one of the most common ones that we see that most people have experienced sometime, if not today, sometime in the past they have tried, which is the metered-dose inhaler, like salbutamol, like Clinell, like Foster, and so many others. Okay, so I'm going to try and share this with you. I hope you can hear well as well.
I'm now going to show you how to use a metered dose inhaler. This technique applies regardless of the medication delivered in the device. Remove the cap and hold inhaler upright with your thumb on the base and your first finger on the top of the inhaler. Shake the inhaler vigorously up and down. Test spray the inhaler before first use and if it hasn't been used in the last 5 days. In a sitting or standing position with your head upright, breathe out gently as far as you comfortably can. Do not breathe out into the device. Put the mouthpiece into your mouth between the teeth and close your lips around the mouthpiece. At the start of inspiration, inhale slowly and deeply and press the canister down and continue to inhale deeply. Take the inhaler out of your mouth and hold your breath for 10 seconds or for as long as comfortable. Then breathe out slowly. If a second dose is required, wait 30 to 60 seconds and repeat the process. If you're using a controller inhaler, it's important to rinse your mouth after use with water.
So here you've heard her saying the term controller inhaler, and I just wanted to clarify that. So when we say controller inhaler, we also mean your preventer inhaler. So oftentimes that's the inhaler that you use more often on a daily basis. Oftentimes it's the one you use morning and evening time, and they usually contain a low dose steroid in it, okay? Now, as we talked about before, the importance of the inhaler technique and the importance of taking the correct inhaler, right dose, right prescriptions, and everything, it's also important to
think about using a spacer, particularly more important so when you're using an inhaler, a pressurized middle dose inhaler that contains steroid, for multiple reasons. One of the main ones is it will help disperse the medication in a safer way for you, and in a way they can get more of the medication down your lungs, leaving less of a residue in your mouth and your throat. You might say, oh, but it's bulky. Oh, I don't need it. Oh, it's, I know I'm doing it right without it. I'm not getting many symptoms, so it must be fine. But are you really getting the most of it is the question, really. I like to think that we should look at the spacer as really our best friend. A lot of people don't know that using an inhaler with steroids can prompt side effects like sore throats. You may have heard of thrush, but it can also cause things like changes in your voice. You may have noticed, maybe not, and maybe an increased risk of cavities or even mouth ulcers. And you think like, oh my goodness, maybe I should actually use the spacer if that's going to help me minimize those side effects. So I strongly encourage you to have a think about that and do try to use your spacer. Now, on that website, you will see that there are videos as well, how to use the spacer with a single breath and hold technique, how to use the spacer with a tidal breathing, which is where you take multiple breaths inside the chamber. And you also see how to use the spacer with the mask, both for children and for adults. Okay, so there's different videos, and if you have a spacer that looks anything like this or different, if you go to the website, you'll probably see it. Now, I've taken at least one, which is tidal breathing, which is the 5 breaths, because, and I chose this one particularly because not a lot of people know about it. A lot of people are used to doing the single breath and to hold technique, which is similar than doing without the spacer. But sometimes you will find more benefits if you're using the tidal breathing. So I'd like to show that to you if that's okay, and I hope you enjoy.
There's nothing inside the mouthpiece.
Sorry, I'm just gonna take it back slightly.
To use your inhaler with a spacer using the tidal breathing technique. First, hold your inhaler upright and take the cap off. Check there's nothing inside the mouthpiece. Shake it well. If your spacer has a valve, make sure the valve is facing upwards. Put your inhaler into the hole at the back of the spacer. If the mouthpiece of your spacer has a cap, take it off. Sit or stand up straight and slightly tilt your chin up as it helps the medicine reach your lungs. The next steps all happen smoothly in one action. Put your lips around the mouthpiece of the spacer to make a tight seal. Press the canister on the inhaler once to release the medicine and breathe in and out slowly and steadily into the spacer 5 times. Remove the inhaler and spacer from your mouth. If you've been prescribed a second puff, keep the spacer away from your mouth. Wait a minute and shake the inhaler again. Then repeat the steps. Some small volume spacers make a whistling sound if you are breathing in too fast. If you are using a large volume spacer like this one, you can use the same breathing technique. With tidal breathing, your spacer should make a clicking sound as the valve opens and closes. When you've finished, take the inhaler out of the spacer and replace the caps on both the inhaler and the spacer. If you've used an inhaler that contains steroids, rinse your mouth with water and spit it out to reduce the chance of side effects. For top tips on how to clean your spacer, please visit our website.
Okay, I hope you found this helpful. I go to this website a lot, and I encourage you to do as well. Oftentimes I share it actually with my patients, the links from this website, so that you can have it your own time, easy reach, and you can watch as many times as you need to. Okay. Now, as we mentioned before, we talked about steroid and side effects of it, and an extra step that you can take to minimize the possible side effects is by rinsing your mouth. You can gargle as well. Some people like to do that. A lot of people like to connect to the time that they're about to brush their teeth. So if you do it right before brushing your teeth, then you know already you're getting that rinse right after, okay? And that way we minimize the chances of the side effects. Oftentimes I hear that you're just taking a sip of water and swallowing it down, and many of you may not realize that you should actually spit it out. So, and that's to minimize the possible other side effects you could potentially have outside your mouth, but on a general aspect of your body as well. Okay, so just important to know that. Now, Dr. Siva touched briefly on the side effect on the triggers. And I always say it's very, very important to identify your triggers. Oftentimes, if you can identify your triggers and manage them well, then you will have less and less asthma symptoms. So by perhaps keeping a diary whenever you do get symptoms, what just happened before, what was I exposed to before, was it cold air, was it warm air, was it pollen, was it exercise, what was it that set me off? Sometimes people tell me, oh, I just had a glass of beer and all of a sudden I had an asthma attack right after. I was short of breath. And sometimes they can say, I just had a fizzy drink, or it could be anything else. It could be dust, it could be, you know, going outside for a walk, or just the fumes from the car, as the doctor mentioned as well. So the more you know about your own triggers, better we can manage your asthma as well, okay? Okay. Now, one thing that's very important is checking how is my asthma actually getting worse, or is it fine as is? And how do you do that? For one, looking at the frequency of your symptoms, looking to see about the how often you're using your blue inhaler, very important, but also checking your peak flow rates. Not many people know their best peak flow rates. On an average, on a good day, or what happens on a bad day. And the best way to do this is by keeping a diary of your symptoms and keeping a peak flow diary. You may have been asked by a doctor or a nurse to do this before. Maybe we've given you a printout to check for about 4 weeks, maybe less, maybe more, because that can give us a better picture of what's happening with your symptoms, and also what's happening when you are taking your inhalers on a regular basis. Okay, so it's very important to know. If you don't know how to check a peak flow meter, or you haven't seen one, you can ask your nurse about it, but you also should look, it might look something like this. Okay, if you've had one before, you may have seen it when you've come in for your asthma review or to see your doctor. Okay, some people have a very small one that they can find easier to carry on their bags, or when they're traveling. It can look like anything, one of these. Okay, oftentimes this is what it looks like. Now, if you're not sure of what your number should be, your nurse can help you identify your best number and where you should be aiming for. Okay, and one good way to do this after you've kept a peak flow diary that looks something like this printout here that you see on the image here is looking at your asthma action plan. As I said earlier, the asthma action plan is quite personalized to your own needs. And when you go to see your asthma nurse for your annual review, she should be giving you an asthma action plan at the end of your consultation. Okay, and this should be a good guide. You should have it handy. We don't give so just so you can have an extra leaflet. Put it in your fridge, keep it someplace safe, share it with your family members. That way they can help you in case you suddenly become unwell. Okay. Now, here is the link that I'm sharing on the PowerPoint. I believe, Nick, you've shared it as well on the chat. I think I've seen you. Yeah. So you can look at the chat here as well, and you'll be able to click on the link for the Asthma and Lung UK, or you can do as you saw in the video, go to Google, type how to use your inhaler, or just type Asthma and Lung UK. You should come up to their website, okay, easily. But on that number that you call, oftentimes they have very well experienced clinicians that can give you helpful tips and next steps and so forth, if you're not able to reach us when you're trying to get somebody on the line right away. Okay. Now, alternatively, come see your GP surgery, go see your nurses. You can even go to your pharmacist. And obviously, if you're having symptoms, don't delay. It can be quite urgent. Things can change very quickly. Okay. I think one thing I really want you to take home from today is that you are your main advocate. You are in control. Is what you do on a daily basis that will matter most. You can come to doctors. We can give you all the meds that we cannot have access to. But if when you are on your own, if you're at home and you're not doing your part of managing your asthma, it's going to be very difficult to live well with asthma. So I encourage you to take charge and make small changes. Small changes can make a huge difference in someone's life and management. So I encourage you to do that. I hope you